Now, joining me via Skype from Lagos is an associate professor of public health, Dr. Kemi Odukoya. Good evening, Dr. Odukoya. Thank you for being with us. Thank you for your time.
Good evening, Ladi. Thank you.
It would appear that some good news is coming the way of health workers with this insurance cover that the federal government has secured for frontline uh, health workers, about 5,000 of them. But I wish to speak to, in particular, the susceptibility of health workers during this COVID-19 pandemic. What are the practical ways that they can mitigate their exposure to this virus?
Thank you, Ladi. Healthcare workers are very susceptible, as expected, because they are the people that COVID patients are going to come in contact with, first of all. Bearing in mind that many COVID patients would be asymptomatic, so it's difficult for healthcare workers to know that people might be positive. Now, the other thing to know with healthcare workers is that they are, if they do become positive, they are also placing other patients at risk and then placing their families at risk. So it's important to prioritize the prevention of infection among healthcare workers. Now, what can we do? The first thing is training and retraining. For all healthcare workers, we need to know that it cannot be business as usual. It's important for healthcare workers to be aware, to maintain a very high index of suspicion when patients come in, such that they can prevent, such that they can prevent, such that they can prevent health infection. It's important that PPEs are in place. Healthcare workers are the most important group of people that require the N95 masks. Sometimes it's a little disheartening to see these masks being worn by non-healthcare workers, and that drives the prices up and makes it difficult for healthcare workers to have these masks. So it's important that whatever we can do, we should do. Healthcare workers must be given priority, and as much as we can, we need to do whatever we need to do, whatever we can to make sure that they don't get infected.
We have heard earlier, before this time, we had heard that it is quite possible that within the hospital environment, which is where the health workers operate, the hospital environment is particularly susceptible to the spread of viruses, whether they are bacterial or otherwise. And therefore, even the hospitals need to take a closer look at their environment. What can you tell us about that?
The hospital environment. Now, it's important that we have an established triage. For every hospital, there needs to be a place. Before the patients come into the hospital, there needs to be a holding place whereby we screen patients and look at and try to determine the patients that are most likely or more likely to have COVID. The patients that are more likely to have COVID would be taken to a separate area with more scrutiny, and then those that might not have COVID will have to be treated. Because we have to remember that even though there is COVID, there are still a whole lot of people that have other non-COVID healthcare symptoms or healthcare problems, and they also need to be treated. So we need to make provisions for COVID patients and non-COVID patients while protecting the healthcare workers. And then the other thing I needed to say was it's important that healthcare workers are given priority when it comes to testing. It's important because when healthcare workers
Dr.
know
Odukoya,
status,
Dr.
yes.
Odukoya, we completely run out of time. Thank you very much for being with us from Asurulere in Lagos via Skype. Thank you so much for your time.
You're welcome.